Welcome to your C-section postpartum recovery mobility yoga practice. So this yoga practice is also going to be done on the floor. We're not going to do a lot of getting up and down, and it will focus on some of the main joints of our body. So we're going to really focus on shoulders, we're going to focus on thoracic mobility, we're going to focus on hip mobility, and kind of our whole spine. So with that, we do a lot of movement with our thoracic area, right? When we're taking care of baby and our day-to-day activities. But what I've noticed a lot with my clients in their C-section recovery is that they can be very guarded around this area, right? Because there was an incision, there was a major abdominal surgery, there still may be a lot of sensations, you can still feel pain, you can still feel tingling and numbness, and we want to bring movement to this area. So we are going to be doing very gentle movements. Everybody says, when can I start doing these? Because you've had a major abdominal surgery, I do recommend waiting at least 4 weeks postpartum for these movements. However, if you're feeling really good around week 2 or 3 and you want to do very gentle variations of these movements, you can give them a try. I like to say wait until your incision site is completely healed. There's still lots of healing going on beneath the surface, but if you feel like you are ready to have some gentle movement, this practice isn't going to be so physical that it would cause any issues with your C-section incision site. But if you do start to feel any tugging or pulling in any of the movements, just stop them and then return to them maybe a week or 2 or 3 down the road. So all we need for this practice is a bolster and a block. And this practice is going to be really great to do during your first year after C-section procedure, because it just really encourages, again, all of that movement in our joints, really good healthy mobility for our body that is needed to care for us and while we're caring for baby in the first year of life. So let's get started. If you don't already have something like a mat or a rug to sit on, just something with a little bit of support, find that. And we're going to take hands to knees and we're going to just sway from side to side. So instead of that gentle circling we did in our restorative practice, we're going to work on finding a sway like a piece of seaweed swaying under the ocean waves as they gently push it from side to side. And then we're going to try and hold our arms out and see if that's okay. And if it is, you can keep your arms there and you can sway them too. And you're just going to work on finding that lateral or side to side movement. And breath is steady. So you can tap into that ocean wave breath that we did in our healing toward breathing, in through nose, out through nose. Very nice. And then hands come to knees. And then we're going to find cat-cow, seated cat-cow. So we're going to exhale and slowly curl into ourselves. And then as we inhale to rise and broaden our collarbones, we take our gaze to the sky and we exhale round back down. So notice that I'm not doing a really super exaggerated arch of my back. I'm not doing a super exaggerated fold. I'm just kind of gently waving my spine through this cat-cow. And you can reduce that movement even more. So you can just make that movement as small as you want. And maybe in the beginning, that's better for you. And then maybe as you progress through the weeks, you can make the movements a little bigger, the arch in the back a little deeper, the round of the spine a little deeper. Very nice. Okay, and now we're going to come to seated on our bolster. So if you don't have a bolster, a couch cushion or firm pillows stacked on top of each other will do well. So I would love for you to try and sit straddling the bolster. If that's not an option for you and that just doesn't feel comfortable, you can sit crisscross applesauce or Sukhasana, which is an easy seat position on your bottom. So if you are on your bolster straddled, we're going to, and if you're seated Sukhasana, we're going to do the same thing. So we're going to work on finding a chicken wing, just like that. And I want you to pretend like you're trying to draw a circle on the wall with your elbow. maybe about the size of a volleyball, and then the other way. Very good. And the hand is just kind of resting on your side. It's not pressing into your side. Very nice. And then we're going to do the same thing with the other side. So gently make that circle. Very good. And then reverse and take your elbow the opposite direction. So we're getting into the shoulder joint, but we're also encouraging some movement of your lat and your anterior serratus. Nice. And then we're going to take our hands in front of us, interlace our fingers, flip our palms out, press the palms away, and slowly, gently bring your arms up over your head. Now notice if you feel a stretching or a pulling sensation around your incision site. And if you do, just bring those arms down a little bit until you don't feel that. But if it's a really, really mild sensation, then you can experiment with how high you bring your arms. We want to make sure the shoulders are down so we don't look like this, but we have relaxed shoulders and length through our arms. Very nice. And then we're going to slowly release the grip. Take the arms behind us, interlace the fingers here, and then press the fingers down behind your back. So you open your heart center, open your chest. What you want to make sure not to do here is really flare the ribs. And I just did that myself. So this is why we kind of notice what we're doing here. So we're stretching and opening the heart and broadening the collarbones, but we want to make sure we don't do this number and really kind of pop our chest out, but ribs stay in, and we focus the stretch in the collarbones. Very nice. And then we release. All right. So we're going to find that bolster right in front of us. So we're going to slide the bolster right over here in front of us. And we're going to find the same kind of cat-cow movements, but we're elevated. So notice how I'm kind of at about a 45-degree angle, and I'm not straight down. This takes quite a bit of the pressure out of your tummy. So we did this in restorative, and now we're doing it a little here, but we're gonna add something a little different. And this is where you might need your block for a little bit of extra height. We're going to do thread the needle. So we're going to take our right arm, we're going to thread it underneath, and we're going to bring our right temple to the block. Very good. So your left arm can be wherever it comfortably falls, on your back, on the floor. If you're feeling adventurous and you want to take your arm up, you can. If when you take your arm up, it puts a lot of strain on your bottom arm or shoulder, just bring it down. We want to focus the twist in our thoracic spine, a very mild, gentle twist. And then over time, you might find that you can remove the block and go just a little bit deeper. And over time, you might find that you can do kind of a full thread the needle with head on the ground. But this is something that you want to progress slowly and at your body's guidance. Very nice. Other side now. So slowly lift up. Thread left arm under and come onto your left temple. Breathe ocean wave breath in and out through nose. And slowly unfurl. Very nice. Okay, sit back and mermaid to the side. So we're going to find a little bit of a side stretch for our intercostals. Slide your bolster or your pillows or your couch cushion right up to your right hip and let your right leg, both your legs kind of mermaid or come out to the side a little bit. All right, so this bolster is here just to give you a little support, tucked nice and firmly into your right hip. Your left arm comes down to the ground, your right arm comes up and over. And this might be where you stay, right here with an extension of your right arm. Over time, you may find you want to go a little more over to your left side. So you can just kind of bend your bottom elbow and find what feels good for you. Now, if you feel a real big pulling sensation, a real big stretch, come out, back out a little bit, come back to the place where you feel a nice opening through this area of your body without too much of a tugging or pulling sensation on your C-section incision site. Very nice. And arm comes down. Beautiful. And legs come in front. And we're going to tuck the bolster nice and firm into our left hip and mermaid our legs out to the right. And then we're going to do the same thing. So right hand comes down to support, Left arm comes up, and this might be where you want to stay. And now notice if you can come over a little more, or when you do come over, you're like, no, I need to back out just a little bit, and then just back out a little bit. Very nice. And then slowly up. All right. So we're going to hang on to this bolster, and we're going to use it as we work into our hip mobility. So we're going to use it for support, and you might want to come down onto your forearms, so you're leaning against it and your knees bend, feet flat on the floor. And we're going to start by crossing right foot over, just like you would comfortably cross your legs in a chair. Now notice if you can just gently press your right knee away. And that might be too much. So then you might need to try sitting up and keeping the cross of the right leg over the left, and then find your hand position that feels good for support for your body, and then try crossing your leg and gently pressing your knee away. Option to do this seated in a chair as well. So just a figure 4 across as we open the hips and an external rotation, and then we release. Very nice. And then we do the other side. So we cross the other leg over and just kind of notice what feels good and supportive to your body, to your spine, to your core, to your incision site. And breathe, ocean wave breath, in through nose, out through nose. Very nice. Gently release that leg. Okay, so now we're going to come to seated on our bolster, and we're going to use our block now. So these are called knee drops, and I like these because it helps to work the internal rotation of our leg and our hip. So we just did some external rotation. Now we're going to work some internal rotation. So we're going to find ourselves in a kind of a yogi squat, toes out. We're going to work on dropping our knee down to the block. Maybe it touches, maybe it doesn't. It doesn't have to. We're just working on finding this femur bone, our upper thigh bone. We want to give it that internal rotation because it just had that external rotation. So we're going to work both areas of rotation. So we're going to alternate for 8. So that was 2, 3, 4, 5, 6, 7, and 8. Very nice. You're doing great. So slide back up on your bolster, allow your legs to cross comfortably in front of you, and we'll set our block to the side. And we're going to work just a little bit of a twist here. So very gentle twist with the support on your bolster. Sit so you're nice and long through spine, and notice if you're kind of rounding, and if you are, try and relax your shoulders and just sit up a little taller. Notice if those ribs are flaring, and if they are, you can even bring your hands and just encourage them to come down with a little gentle press on your ribs, and then allow your hands to come down to your legs. And we're going to start by twisting to your right. So we're going to cross left hand over to right knee, and maybe that's where you stay, just like that. And if you want a little more, right hand comes to the bolster, and we just look over our right shoulder. So when we do these twists, we're going to focus them from our shoulder blades up. So we're not going to be twisting into our lumbar spine, but we're going to focus the twist from about the bottom of our bra strap up. So it's a very mild twist, a very gentle twist for a few breaths. Very nice. And then we untwist the spine. Right hand crosses to left knee, and maybe you stay right here. And if you want a little more, left hand comes down, and you take your gaze over your left shoulder. And untwist. Very nice. And we're going to end with a little bit of breathing just to encourage our ribs down and in as everything settles back down. So I'm going to come just a little bit closer. So remember, I said we're going to focus on bringing our ribs down because they've been flared out during pregnancy as our baby grew and our belly grew and everything grew and expanded. So we want to encourage our ribs to come back down. So we're going to bring those hands right there to that rib cage, and we're going to take 3 of those diaphragmatic breaths that we did in healing through breathing. And we're going to inhale through nose and exhale through mouth as if we're blowing out a candle. Relax shoulders. Gently press your ribs in just ever so slightly. Inhale through nose and fill belly, ribs, heart space. Exhale, mouth. Inhale. Exhale. Last breath. Inhale. Exhale. Very good. That was your postpartum C-section mobility practice, yoga practice. I'll see you over in the next section.